गुड आफ्टरनून स्टूडेंट, हाउ आर यू? कैसे हो आप? आज का टॉपिक बड़ा इंटरेस्टिंग टॉपिक है, इट्स कॉल्ड हाइड्रोसिल। तो मोस्ट इम्पोर्टेंट टॉपिक इज हाइड्रोसिल, विच इज़ वेरी इंपॉर्टेंट एंड कॉमनली हाइड्रोसिल पेशेंट वी आर सीइंग। बहुत सारे पेशेंट देखने को मिलते हैं और हाइड्रोसिल का ट्रीटमेंट बहुत अच्छा है, बहुत अच्छी तरह से हम उनको ट्रीट कर सकते हैं, बहुत अच्छी तरह से हम प्रैक्टिस में उसको इस्तेमाल कर सकते हैं। तो आज हम जानेंगे हाइड्रोसिल के बारे में। तो टुडेज टॉपिक नेम इज हाइड्रोसिल। Purpose statements. At the end of this lecture, should be able to define hydrosil, etiology of hydrosil, types of hydrosil, surgical management of hydrosil. Learning objects of this topic: define hydrosil, etiology of hydrosil, types of hydrosil, surgical management of hydrosil. Domain is cognitive and level in must know. Hydro, water cell cavity. That is hydrosil. Definition: accumulation of the watery fluid in the layers of tunica vaginalis is hydrosil. Etiology: excessive secretion by the layers of tunica vaginalis, destructive absorption by the layers of tunica vaginalis, interference with drainage of fluid by the lymphatics. Types of hydrosil: primary hydrosil, secondary hydrosil. Primary hydrosil, unknown etiology. First is vaginal hydrosil, congenital hydrosil, infantile hydrosil, funicular hydrosil, ancestral hydrosil of the spermatic cord, which is rare. Secondary hydrosil, known etiology. Causes: epididymoorchitis, malignant disease, syphilitic affection of the testes. Primary hydrosil, vaginal hydrosil, accumulation of the watery fluid in the layers of tunica vaginalis. Most commonest: translumination test is positive, fluctuation test is positive. One can get above the swelling. Congenital hydrosil: when the processus vaginalis is directly communicated with the peritoneal cavity, known as congenital hydrosil. Swelling is reducible in supine position. Swelling is prominent in standing position. Translumination test is positive. Fluctuation test is positive. Infantile hydrosil: when the processus vaginalis is communicated with the tunica vaginalis but shut off at the deep inguinal ring, known as infantile hydrosil. Swelling is seen in scrotal and inguinal ligamental region. Translumination test is positive. Fluctuation test is positive. Funicular hydrosil: when the processus vaginalis is shut off at a deep ring as well as superficial ring, known as funicular hydrosil. Swelling is inguinal, no scrotal swelling is there. Testes can be felt separately. Ancestral hydrosil of the spermatic cord: when there are cyst-like swelling over the spermatic cord, known as ancestral hydrosil of the spermatic cord. Traction test is positive. It is a rare type of disease which is not commonly diagnosed by simple person or simple doctor. Surgeon should be there for the diagnosis. Treatment: no place for conservative treatment. Japanese eversion of sac, Lord's excision of sacs. Main questions are: define hydrosil, enlist etiological factors of hydrosil, enlist type of hydrosil, explaining short surgical management of the hydrosil. Bibliography: of course, S. Das, Concise Textbook of Surgery, Textbook on Shalya, Tantra by Dhani, and Practical Guide to Operative Surgery, Love and Balance. Thank you, students.